The mission of the European Association for the Study of the Liver is to beat liver disease and to improve liver health. And to achieve that mission, you need to do a lot of things. Of course, you need to also develop the best science there is. But if it's just about the science known to a little group of people, that will ultimately not translate into a better care for the patients. So we have several pillars in EASL to achieve that mission, and one of the 4 pillars is education. It's really about creating a portfolio of educational materials that can help enhance the knowledge and the skills and the competencies of the people that have to take care of people living with liver disease. I'm not truly an epidemiologist, so I will just give a few examples, and one is coming from the field that is my area of expertise, which is the metabolic dysfunction associated steatotic liver disease. And current estimates are that about 1/4 to 1/3 of the adult population worldwide, it's not just Western societies, it's really worldwide, suffers from steatotic liver disease, which does not mean that they will all evolve to advanced liver disease, but at least it means that their liver is unhealthy. And a few percentages of them will evolve to liver cirrhosis and the deleterious consequences of that. Another example is that hepatocellular carcinoma ranks 7th among cancers worldwide, but 2nd in terms of cancer-related mortality, also illustrating how big the problem is of liver-related diseases. And some of these diseases, like, as I said, metabolic dysfunction-associated steatotic liver disease, has a lot to do with the problems of overweight, overnutrition, and not enough physical activity. And we know that these metabolic problems are still increasing in terms of numbers. So it also means that if we make projections that the amount of people with severe liver disease is already quite high and will continue to grow over the next decades. Most of these patients, but not all, but most of them are already known with some chronic liver problems, although not always knowing how severe it is. And then there is some triggering event. It can be an infection, it can be bleeding, but sometimes also we don't know exactly what the triggering event is. But quite suddenly their situation deteriorates and liver function declines. And in the context of that, sometimes also other organ functions will decline, most notably cardiovascular system and the kidney, for example. So they do a quite rapid, acute deterioration of their physical condition, which can then be dangerous on the short term because they can very rapidly decline, and all those organ functions are potentially follow in terms of deteriorating. And so these patients are really at a high risk of even more severe disease and of dying. But it's really an acute event, and with all the instruments that we have in critical care medicine, we can revert the situation and bring them back in a more stable situation. But sometimes the evolution is so rapid that even with all the modern tools we have, we are not able to rescue these patients. One of the difficulties is that, first of all, the underlying chronic liver disease sometimes has very little symptoms, and also some of the initial symptoms of a rapid decline in liver function will not be picked up because they are quite subtle, they are vague, they are not very specific. So many of the small signs you might have that the situation is declining are not picked up. Not always picked up by the patient, not always picked up by the physicians that initially see those patients when they go and say, okay, I'm not feeling well. So it's more that lack of specific symptoms that make a lot of cases being diagnosed a little bit later than they could have been diagnosed if the signs were picked up early. Another issue is, of course, that there is, the concept of ACLF for people that are specialized in it, I think is quite clear, but the definitions are not always the same across countries and societies. So there are some different definitions around, which creates sometimes a little bit of confusion. I think in clinical practice that's probably not that important because the concept is clear, but in terms of coming to management strategies, guidelines and so on, then a consensus about the definition is of course also important. There are several unmet needs. One, of course, is that we still have a lot of unknowns regarding the whole pathophysiology of it. And it's also a very heterogeneous population. It's a relatively rare condition in a certain way, which makes that it's not so easy to understand the complexity if you have a relatively small population of patients. So a better understanding of the underlying mechanisms and also a better understanding of the heterogeneity, because some of the patients you already know up front that they are more severely ill and more difficult to improve than other ones. But the tools to differentiate the different categories of patients in terms of their risk of a rapid deterioration is also something that is still lacking. So a better knowledge about the pathophysiology and a better insights in risk stratification within this heterogeneous population is, I think, are one of the important unmet needs. And then, of course, once we get to trying to find something that is efficacious in terms of therapy, again, we are a little bit hampered by the heterogeneity of the patients and our lack of understanding of the natural history. Some patients will rapidly decline despite whatever we do, and others have a little bit of better prognosis and might benefit from early intervention and efficacious intervention. Well, I think there are several explanations. First, it still takes a little bit of, I would say, being specialized in taking care of people with that advanced stage of liver disease to be into the concepts of ACLF and what it means in terms of patient management. So I think the general hepatologist is probably not so well educated about this problem and probably also doesn't realize how important it is to early diagnose it and to early refer those patients to specialized centers. What I also experience in my own referral network is that sometimes patients, when they get into the stage of what we then call ACLF, are sometimes labeled as very advanced liver disease for which we cannot do anything anymore. So those patients are probably not always optimally managed because there is insufficient knowledge about what potentially can be done for these patients if we have a more granular approach and also if we tackle it earlier. And that's one of the big problems that, as we discussed previously, as the signs are not always that straightforward to recognize, some of these patients are diagnosed a little bit later than what probably could be done if the signs were picked up. And so once you are more down the road, then it's obviously more difficult to return to a positive position. Raising awareness in the scientific community is, I think, of the utmost importance. It's really critical that the people that take care of people living with liver disease know this and are able to pick up the signs early, manage the patients accordingly, and refer them to specialized centers once it is clear that ACLF is developing, preferentially before the full-blown ACLF is clearly there. So it's clear that kind of creating awareness in the scientific community, the medical community, the hepatology community, but also all the other disciplines that are involved in the care of these patients, like the intensive care colleagues, the nephrologists, etc. They should all be well aware of the existence of this syndrome and what the guidelines are to manage these patients. How to do it? I mean, there's no one-fits-all solution for that. As with any education, you need a portfolio of things, and some things will work for some people in some specific conditions, and in other educational settings, healthcare settings, you need other tools. And also for younger people, you need other tools, and for more established people. So you really need a portfolio of activities. I think being present in postgraduate courses of several societies, not only the liver community, but as I said, also the other communities, is of critical importance. Having it well incorporated in the basic medical curriculum, that at least medical students have heard of it, making it an item that is part of the education in different specialties, like intensive care, like internal medicine, having it incorporated in the curricula of all these different medical specialties, I think is highly warranted and would already help the field forward. And then it's about continuous medical education with all the portfolios we have. As you know, in EASL, it was one of your first questions, we have a whole portfolio of different educational activities, and I think also having their ACLF on a regular basis on the agenda should be helpful in creating more and more awareness, at least in the medical community. I think there it's more about liver diseases in general. I think creating awareness about ACLF in the general population is probably a different topic or a difficult topic, although I think it's important that we emphasize on the fact that liver diseases are an important cause of morbidity and mortality in the population. People know about liver transplantation. So really emphasizing on how severe liver disease can be and what a tremendous impact it has on quality of life and on health in general. That is, I think, of crucial importance. Not just on ACLF, because that's really the end stage and probably a little bit frightening for people, and it will be a little bit far-fetched, I think, for the general community. But it helps, like with liver transplantation, to help people realize how important it is to think about chronic liver diseases, to screen for them, to detect them, and to tackle them as early as possible in order to just avoid those end-stage consequences of liver diseases. I think it's critically important to have that collaboration with all these different specialties and different levels also of healthcare in the system, because it's a very difficult population to help, to treat, and so every little detail can help. Having a team of nurses that has experience with this kind of patients will be helpful, as we know for many other aspects of medicine. If health caregivers have experience and knowledge, the quality of what they do will be superior to people that, although they are sometimes very motivated, but have less experience. And that's a general principle, and it applies even more to difficult situations like ACLF, where, as I said, every little detail counts. Many of these patients will ultimately go through an intensive care ward, so having a very intense relationship, also collaboration with the intensive care physicians, is critically important. As a hepatologist, we have our expertise, they have their expertise. That expertise should come together, and ideally, in a team that treats patients with ACLF, you can count on intensive care physicians that have experience with the treatment of that kind of patients. In my personal experience, the neurologists, at least in the teams I have been working with, have liver disease on the radar of patients with neurological impairment. But also there, it's a difference whether you have neurologists that have experience with this patient population or colleagues that just have it as one of the theoretical possibilities in the list of causes, but do not have the practical experience or just a limited practical experience. So again, comes back to exposure, experience, and the more exposure and experience people have, the more the team will benefit from it, and ultimately also the patient will benefit from it. The context in which it develops, of course, is in a context of very advanced impairment of the liver function. The liver function is very complex. When you have ACLF, there's also a triggering event, and you get a whole cascade of mechanisms. So on top of already a complex normal liver function, impaired liver function, you have then that cascade of mechanisms triggered by infection or bleeding or something else. And so you get into a very complex system of mechanisms that reinforce each other and that cause a rapid decline of the condition of the patient. But as you have so many mechanisms involved, it's at least conceptually possible to try to intervene at a certain time point, so that all those mechanisms that in a kind of vicious circles are reinforcing each other, that you stop those vicious circles from turning, and that with all the support the patient had, and if you have enough time, step by step the patient can recover. Is there a point where it's too advanced that it's really not reversible. With our current knowledge and tools we have, probably there is. But I think that there are many opportunities in that whole cascade and in that time frame to intervene, where you probably can be successful in at least stopping the decline, and then with all the support around, step by step, bring the patient back into a better condition. It's never easy, because all these mechanisms are very rapidly causing deterioration. As I said, it's a heterogeneous population. The mechanisms are potentially very diverse and different from one patient to another, so a one-fits-all solution is probably not what we are going to have. But with the evolving knowledge, I'm quite confident that we will discover treatment opportunities that, at least for a certain number of patients, will be helpful in stopping the evolution and bringing back the situation from an ACLF to a hopefully compensated chronic liver disease. I hope, first of all, that we will still improve on understanding the mechanisms driving ACLF, and especially also in understanding the heterogeneity of the patient population, because it's really different from one patient to another, and we have some, but still quite limited understanding of that heterogeneity. Because probably if we would be able to better understand different subgroups of patients, probably first of all we could have a management tailored to the specific subgroup of patients. And probably also, if we are able to develop more therapeutic opportunities in terms of pharmacological intervention, we will probably be able to better identify those people that are more likely to benefit from a specific drug, and others that are probably not very likely to benefit from it, but might benefit from another one. So that progress in our understanding of disease mechanisms and especially patient heterogeneity is, I think, a very important first step that we need before we can truly improve on the outcomes of these patients. And in parallel, I think we're looking forward to see hopefully several compounds developed in this area. And if we have more awareness and we have more patients that are referred earlier to centers with expertise, we can probably expand the population that could help us to run all these clinical trials.